Hi all, I'm Professor Dragan Illich from the School of Public Health and Preventive Medicine, and welcome to this short presentation in which we'll cover the basics for critically appraising your upcoming critical appraisal task on harm. This particular presentation focuses on appraising studies that are either a randomised controlled trial or a cohort study as they relate to questions of harm. So the first part of the assignment is fairly similar to the last assignment in terms of critically appraising a study around therapy, in which we focus on the methodology. So the first part focuses on, are the results valid? So much like the previous critical appraisal, the first question is looking at selection bias. So basically we're trying to identify whether the groups of patients are similar in all ways, apart from the fact that one group has been exposed to the risk factor and the other group hasn't. So if it's a randomised controlled trial, well, obviously randomisation and allocation concealment will come into play. If it's a cohort study, obviously you can't randomise, so that bias comes into play there. I guess the other thing to consider is looking at the baseline characteristics to see if they're similar or different, and if so, were there any statistical adjustments made to account for any potential differences between the two. The second point that we're looking at focuses on the methods in which the outcome was detected or assessed across the two groups. So again, if you want to relate it back to the biases, we're relating this to detection bias. So we're seeing whether those researchers, clinicians, etc., were they blinded in any way to the fact that one group was exposed to the risk factor and that the other group was not. The third thing to look at is looking at the follow-up of participants. So follow-up in terms of duration, so whether the exposure, I guess, was sufficient in your eyes in order to see an effect. And also, secondly, if we think back to attrition bias, so identifying whether or not there are any dropouts, and if there were they accounted for? So was it due to side effects, any other co-exposures, any other, I guess, potential confounding factors that may have influenced the dropout rate of participants in the study. So the second aspect that we're looking at are the results. So very much similar to last time, for a harm or cohort study, I want you to identify what the relative risk or risk ratio was. So when we talk about risk ratio, that's when we're referring to person years. So if you keep the denominator consistent as person years, you'll be able to calculate it. So it might be 1.5 per 100,000 person years in terms of exposure for the particular study. The second point, how strong is the association between exposure and outcome? We're looking at you to describe what the relative risk basically means. So if we've got a relative risk of 1.5, that's an increase of 50% in the risk of that particular outcome occurring. And thirdly, how precise is the estimate of risk? Again, that's focusing on the confidence interval. So keep in mind the width of the confidence interval, what that can tell you about the sample size of the study, but also whether or not it includes one, if we're looking at relative risk, if it's above one, below one, what that means. So the third aspect which differs for this assignment relates to whether or not the results satisfy the diagnostic tests for causation. So when we're looking at studies around harm, we're trying to identify whether or not the exposure caused the outcome. So the first question is it clear that the exposure preceded the onset of the outcome? So something like smoking and lung cancer. So smoking precedes the onset of lung cancer, so we can discuss that and build a case in terms of causation for that particular risk factor. Is there a dose response gradient? So this will more so be relevant for studies around drug interventions, for example. So if you're focusing in on secondary outcomes, so you may be looking at I don't know, NSAIDs for a particular therapeutic outcome, an assignment around harm, you may focus on the adverse events of that particular NSAID. So if it is looking at different dosages and whether the outcome increases in severity, that's a great example of a dose response gradient. For quite a lot of your studies and questions, it may not be possible to demonstrate a dose response gradient. That's fine, as long as you explain why that is the case. You won't be marked down. And finally, is there any evidence from a de-challenge re-challenge strategy? So basically, de-challenge re-challenge just means if I provide the exposure to the risk factor, does it result in a particular outcome? So if I can remove that particular exposure or risk factor, does the outcome change? So again, something like NSAIDs, we provide an NSAID to a patient. He or she may have some GI side effect. If we remove the NSAID, so the patient doesn't consume the NSAID, does their GI side effects also cease? So again, that's an example of de-challenge re-challenge. So by taking away the exposure or risk factor, does it change the outcome? Again, it may not be relevant depending on your question and your study that you've chosen. So in that case, again, please just describe why that's not possible and what implications it may have for your study. So the final point relates to the application of the evidence to the patient. So looking at the patients that were provided in the study in terms of their baseline characteristics and comparing it to your patient. Totally fine if your patient is not similar to those in the study. Again, it's just a matter of highlighting that that is the case and potentially that as a limitation for applying the evidence to your particular patient. Was the duration of follow-up adequate? So you can mention it, I guess, in the first part, but here we want you to really tease out whether or not the duration was adequate. So this will, again, only be applicable if your study is an RCT or a cohort study. We'll discuss case control studies in the next presentation, but for those who do choose a case control study, you won't need to answer this particular question. What was the magnitude or seriousness of the risk? In answering this question, please refer to the number needed to harm that you calculate based on the results available in your study. And then finally, wrapping it up, are there any benefits that potentially offset the risks of exposure for your particular study and your question, or if not, should an attempt be made to stop the exposure to the patient? So something like NSAIDs, you may say, well, you know, the risk of having a GI side effect is a relative risk of 1.1. It's fairly sort of negligible, so the benefits may outweigh the exposure. Counter to that, if we look at the example of smoking and lung cancer, if we end up having a relative risk of 15.5, well, it's clear that that an attempt should be made to stop the exposure in the patient. So this is the overview of the critical appraisal task for harm. So very similar to the first assignment. The only difference being that your question needs to be one around harm. So does this particular intervention increase the risk of side effects, increase the risk of mortality, morbidity, whatever it may be? Totally fine if you want to concentrate on a secondary outcome. So like I said, with the NSET example, you may be looking at, the primary question may be one around therapy, but you may choose to focus on the harm aspect being the adverse events. As per your first assignment, a brief clinical vignette detailing the patient's relevant problems, define the information gap, identify the PK components, use those PK components to construct your question, go through a detailed search strategy, so highlight which databases you may want to use, but for your actual search strategy, only focus it in on Medline, preferably on Ovid, but if need be, feel free to also use PubMed. Please list the studies that you've returned in your search, so just a screenshot is more than adequate there. Similarly with your search strategy, just a screenshot that details the entire search strategy is fine. You don't need to list out each line one by one. Similarly, describe why you have chosen the study that you have, feeding it back to the evidence pyramid and any other issues, but also a one sentence in terms of why you've not chosen the other studies. And I'm quite happy for you to group the studies together. So you may say that study 1, 2, 3, and 4 did not relate to the patient. Studies 5, 6, 7 weren't relevant to my exposure, whatever it may be. Justify why you've chosen the particular article, and again provide a legible copy, preferably a PDF of your article. Assignments won't be marked unless you attach that with your final submission. So in terms of your harm assignment, you've got one or two choices, or three choices if you want to look at it that way. You can either choose to answer your question using an RCT or cohort study, in which case please use this particular critical appraisal template. Otherwise you can use a case control study, in which case please use the case control template. Depending on which article type you choose, there will be a specific drop box. If your article is an RCT or cohort study, please submit it there. If you choose a case control study, please submit it to the assessment drop box that says case control study. Due date is 13th of August. Some of the rural sites, depending on when you start, may have an extra week or so, but I will communicate that to you directly. Submission is through the Year 3 EBCP Moodle site, and once again please provide an electronic copy, preferably in Word, of your critical appraisal as well as your article. In terms of your assignment, please just combine it as one Word document. So the first part of the assignment, your scenario, search strategy, describing your studies, etc. Couple that with your answers to the template as one document, and then also attach the PDF of your article as the second document. There will be a Turnitin score that you will have returned once you submit the assignment, and you can submit it as many times as you wish. Just be mindful that as you approach closer to the date, the turnaround for the Turnitin scores may blow out to about 24 hours. Otherwise, that's it for the assignment. As always, feel free to email me if you have any questions or queries. Good luck.